There's now an experimental pacemaker that's smaller than a AAA battery.
And vitamin D may boost the odds of breast cancer survival. CBS 2's Lisa Sigell here now with today's Health Watch. Lisa.
Hi, you guys. Yeah, that pacemaker is so tiny. We'll hear about that in just a sec. But first, vitamin D may help women with breast cancer survive the disease. Researchers say patients with high levels of vitamin D in their blood were twice as likely to survive. They say vitamin D should be included to supplement other breast cancer treatments. Now, vitamin D is produced naturally by the body from exposure to sunlight, but it's also fortified in milk, cereals, and other foods. The best sources, fatty fish and fish liver oils, as we know, can also be taken in supplement form. A new study shows a method for classifying tumors called molecular subtyping can better identify which breast cancer patients are at high risk of recurrence. The genetic profiling separates tumors into 4 really distinct types of breast cancer. Researchers in Florida analyzed 148 patients and found a substantial number who were classified low risk turned out to be high risk once their subtype was determined. Well, scientists are testing a new pacemaker in the U.S. and as we say, doctors say that small device could have big benefits for some heart patients. Researchers at Mount Sinai Hospital were the first in the U.S. to implant this new experimental pacemaker, smaller than a AAA battery.
This device doesn't require surgery, so that means there's a low risk of infection.
Surgeons use a catheter to guide the new device up through a vein in the leg and screw it directly into the heart muscle. Doctors say the new pacemaker doesn't have wires or leads, which may be another advantage.
The problem is if ever that lead has to be removed, then it's very difficult to remove that lead. It's also a problem because that lead, which is what communicates with the heart, that lead can fracture.
Pacemakers are necessary when a patient's heart doesn't beat fast enough or work properly. Dr. Vivek Reddy says the procedure takes 5 to 10 minutes, and the recovery is also faster. The device corrected Gregory Dobin's heartbeat, restoring his pulse to a healthy 60 beats per minute. The 83-year-old, who was left with facial paralysis after cancer, says his breathing has also improved since getting the device.
I feel much better, I'm telling you.
And more than 600 patients are expected to take part in a nationwide study to make sure the new pacemaker is safe and effective. And if there is a problem, doctors can remove the pacemaker simply through that catheter. The device is already approved for use in Europe and currently can only be used to regulate the lower chamber of the heart. But some doctors are calling this a game changer.
Yeah, pretty amazing. Thank you very much,
Thanks,
Lisa.
guys.